Good morning, everyone. Again, my name is Karina Ojeda. I'm the Health Disparities Program Manager at ADHS. So I oversee the CHW Voluntary Certification Program at the state. I'm fairly new to my position, so I just started back in March. Previously, it was Karen Watts who was working with you all. So I'm completely honored to be able to fill in her shoes and continue working with you all. Amazing, amazing people in the work that you guys do. So as Fleur mentioned, a lot of individuals are going to be coming up on the recertification. If you haven't received that notification already, you might be pretty soon. So we're going to talk about all that details, what to be looking out for, and how to prepare for that process as you come up, because it's very important for you all to begin that process now if you're going to be coming up for recertification in November. So I'll try to keep an eye on the chat as much as possible. Um, if there's any questions in there, please feel free to unmute yourself as well too. I'm going to go through my PowerPoint and then we're going to go through, I'm going to walk you through what the website looks like, and then we'll have time for Q&A at the end. Please use this time to ask as many questions as you can. If I don't have the answers for you right now, I'll be writing them down and then we'll send it in the follow-up email with the recording from today, the slides and resources, and then those answers that I can get for you. So we'll go ahead and dive in. So again, we're here to talk about the voluntary recertification process. My name is Karina Ojeda. So just to start with a little bit of a background. So as of this morning, there are 487 CHW certified within Arizona. That is absolutely amazing, and we want to keep that number going. So the online application for recertification opened up on November 7th of 2022. So that's what I mean when CHWs are now going to be coming up for recertification starting November, since it's a 2-year cycle. So we're going to talk a little bit about that. To see a list of all those who are certified, you can go to azcarecheck.com. So that's a database that is open to the public for those who have received their application and are certified. That's how I was able to check that number for the 487 this morning. And then we'll go over the special licensing website that features all the resources to obtain for the process of completing the application. And then we'll talk about the CHW voluntary certification document that is available in English and Spanish and has been updated with the recertification information. Thanks to Flora and her team at ASCHL helped out with that Spanish translation. So again, just talking about the basics of certification. So for those of you who know already and those who may be hearing it for the first time. So for certification, there's some eligibility requirements that you need to have. So being 18 years of age or older, documentation of citizenship or alien status, high school diploma, equivalent diploma, or higher education degree, including those obtained outside of the US, documentation of training and or paid volunteer experience, depending on the pathway that you're going to be using, and then completion of the initial CHW certification application online. And I'll show you where that portal is at. Submission of non-refundable fees. And then there is no examination or testing requirement to obtain the certification. And that is also the same for the recertification process. So a notice from the ADHS special licensing. So notice of deficiency and request for information. So when you are completing your application as well as your renewal, please make sure that you're using a personal email address that you can easily access. So a lot of individuals sometimes use the email address that they're using for their current employer. Just keep in mind that if you do change employers later on and you no longer have access to that organization email, you won't be receiving notifications from special licensing about the renewals coming up or if your application was denied or any changes of that nature. So please make sure you're using a personal email that you will continue to have access to and save that password so you can go in and continue checking for that information. So if there are any type of deficiency or request for additional information, special licensing will reach out to you to ask for that information, and they will give you a date as far as the deadline when you should be submitting that information to continue with the application process. Now, if your application is denied, do not complete an entirely new application. Just work with the special licensing team to either provide them whatever was missing or make corrections that are needed. And of course, you can reach out to them at any time. There's an email address that you can reach out to or by phone. They do take a little bit of time to respond, so please know that they do receive your message. However, they do oversee other type of special licensings, so they do get a little bit busy. And again, that's why we're starting that conversation today, because of the timeline that it can take to become recertified. So requirements to maintain your certification. So we all know that certification is valid for 2 years. So again, coming up in November 2024 for those who did the first round. The fees are going to be a little bit different this time for recertification. So typically for an initial application, you pay $100 and then plus the $200 application fee for a total of $300. For this recertification, you're only paying the application fee, so only the $200. And it's very, very important that you guys submit this application before the expiration of your current certificate, because if it goes past that expiration date and you're no longer valid, you're going to have to redo the entire application process again and pay that $300 fee. So to save that extra $100, please do so before your certificate expires. And again, allow that time for special licensing to complete the process. I would suggest starting now 3 months prior if you're able to. I would not go past a month, again, because of how long that turnover can take. And so another requirement for that is completing a minimum of 24 hours of continuing education hours within the 2 years prior to renewal. So we'll talk a little bit more about what continuing education hours are and how you can obtain those. And those can, again, go from 2 years prior. So it doesn't all have to be done right now. You don't like, now that you have the notification of the 3 months coming up, you don't have to throw that 24 hours into the mix. If you have certificates and hours from your time within those 2 years that fall underneath what we'll talk about for continuing education hours, you can use that for this recertification. Along with that, you'll be submitting the continuing education attestation form. And that's really all you're going to be submitting. All your certificates about the continuing education hours, you don't need to submit those, but please keep them handy, because if there are any audits that need to be done, special licensing will request all of those certificates to make sure that you do have the continuing education. But for the application itself for recertification, you're just completing the form saying that I attest to having completed the 24 hours, and I'll show you what that looks like when we're done with the presentation. And then, of course, if you have any updates to your name, contact information, please again notify special licensing so they can update your profile so you continue to receive those notifications. So something I wanted to throw in here about the renewal applications, this only applies to those that it applies to, but again, I wanted to kind of throw it out there because it is on the special licensing website. So if you're convicted of a misdemeanor or a felony, including a DUI, with your application process, you're going to have to submit a photocopy of court records documenting the disposition and verification of completion of that disposition, and it must be uploaded with that application. Same thing if you had a professional license or a certificate suspended, revoked, or had some type of disciplinary action against it, you'll have to submit that additional documentation as well. And then if you're currently ineligible for licensing or certification in any state because of that license revocation or suspension, you'll have to submit that documentation again. Applicants renewing their certification do not need to resubmit any type of training, experience, diploma that you did in the first time. Again, you're just submitting the form for the attestation of the continuing education and submitting fees, and that's it. So again, I just wanted to throw that out there in case it applies to you. The information is there. All right, so now we're going to go into the approved continuing education courses. This is the reason why we set up this meeting, Flora and I. We wanted to kind of talk a little bit more because there's been a lot of questions in regards to what continuing education hours look like, what is that requirement, and how to find those hours as well too. So we're going to dive into it. And then again, we'll have time for some Q&A at the end, and we'll show you the list of where you can find some of these resources if you are looking to complete courses now. So a certified CHW needs to complete 24 hours of those continuing education courses. And again, that can be within the 2 years, as long as you have the certification. the certificate or something that documents that you took those hours, those classes. On that certificate, it also needs to list what was related to the core competencies for it to count. So what I mean by that, these continuing education hours need to directly relate to the core competencies, including services, skills, and knowledge that either facilitate access to quality of care delivery and health outcomes for clients receiving services, and or expands health and wellness in diverse communities to reduce health disparities. It needs to have educational objectives that exceed an introductory level of knowledge related to health and community services and consist of courses related to core competencies such as those listed on the screen A through L. So I know that's a lot of information. It's very high level. So again, we're going to talk about it. It's very simple. The continuing education course just needs to relate to those core competencies that you took initially when you became a CHW. And if you have questions on that specifically, you can reach out to myself, you can reach out to our special licensing team, and then I'll show you right now the agencies who do provide these continuing education courses already. Something I want to note too is it's just a continuing education course or hour. It's not a CEU, it's not a continuing education unit. It's not very high level. It's just some type of training or course that, again, relates to the core competencies of CHW that falls underneath these categories. So for the approved continuing education courses, we do have a list already of agencies that provide these type of continuing education courses. I'll show you on the website how to access these links, and you'll get sent the PowerPoint as well too. And then I'll give some time for Flora to explain the ones that ASCHW have available as well too. So that way you guys know where to easily access to. Again, you don't need to submit the certificate and courses proof to special licensing when you're submitting your application. You just need to have them handy and ready in case there is an audit that they request that information. So continuing education courses are developed, endorsed, or sponsored by one of the following agencies mentioned below that meet the requirements about relating to those core competencies. So we have the National Community Health Worker Training Center, the ASCHW Training Center, CDC's Training and Continuing Education, Arizona Alliance for Community Health Centers, National Commission for Health Education and Credentialing, American Diabetes Association, Western Region Public Health Training Center, Indian Health Service, and other certified CHW training programs approved by the department. So what that means is that there's been some continuing education course that has reached out to the Arizona Department of Health Services, and us as a certifying body, we're able to review and say, yes, the agenda or the workbook or whatever is being used in this continuing education course does meet the requirements of the core competencies, and then we endorse them. So we say like, yes, you can go out, we'll give them logos, and then you can see that it's clearly been endorsed by ADHS as a continuing education course to apply for the CHW either certificate or recertification. And we'll talk a little bit more about those as well. So other training programs that are approved by the department, any continuing education course that's offered by an accredited college, any CE course offered by training programs approved through ASCHW through their CHW training approval process, and there's a list of those agencies there. And then, as I mentioned, ADHS has endorsed a couple of other education courses that are already approved for recertification. So an example of those are Banner Health, American Heart Association, American Cancer Society, Texas A&M University Center for Community Health and Aging. So some of these have already been circulating around. I'll let Flora talk a little bit more about ASCHW's training. Banner Health has been doing some training as well too. When you receive those notifications, somewhere on that document or email, it should say that this course has been endorsed by, yes, Flora, I'll slow down a little bit. Sorry about that. I get excited about all this information. And so some of these courses will show that they have been endorsed by ADHS and are approved for those continuing education requirements. All right. So one thing I did want to note, this actually happened this week. So the Bureau of Special Licensing, that is the department who completes these applications for us. They're the Special Licensing Bureau. They're going to be changing their name to the Bureau of Licensing for Professions and Occupations. So I wanted to let you all know that, just in case when you are seeing those notifications come up, you are not being thrown off by the name. So it's still going to be the special licensing, but you'll receive some type of notification saying it's now the Bureau of Licensing for Professions and Occupations. I checked in to see if the special licensing email is going to be changing. I haven't received a response just yet. So once I receive notification on that, you'll see it across the website and those notifications, and I'll try to share that out as well too. So some things I want to let you know about the name change. It's going to be happening over the next couple of weeks and the months. You'll see it slowly across the website, communications, emails, licenses, certificates, documents, and forms. Anything that you have now that, if you can please mute yourself, that'd be great. Thank you very much. And so for those that already have certificates or licenses that have special licensing on there, they're still going to be valid. So don't worry about that. It's just now moving forward, you'll start seeing more of the licensing for professions and occupations versus special licensing. They'll keep continuing to have me informed and you all informed, again, via the website, and you can reach out to them with any questions that you might have. So here's a list of our resources, and again, you'll get copies of this. And that is all for my presentation, and we'll do a quick walkthrough. I'm still good on time, so we'll do a quick walkthrough of the website that I showed you all. Can you all still see my screen? Perfect. All right. So this is the special licensing website. So again, you're going to see the changes soon to the name. Everything on here should still stay the same. You still have the community health workers folder here that has all of the relative resources. So if you go to community health workers and then you go to continuing education, this is where the links are that we went over in the presentation. So again, you can see which continuing education courses from these agencies the links are to go straight to them to find out what is available. So example, this is ASCHW. You can click on National Community, and it'll take you straight to these organizations to be able to find those continuing education courses. So at this time, I'll pass it to Flora so she can kind of talk a little bit more about those that are available at ASCHW.
Thank you, Corina. And I think that I think that before we go into the actual trainings, I would like to come back and ask you, because I know that there was a lot of information that Corina presented right now, and really good information and vital information to do the recertification on time. So I would like to ask, and if anybody has any questions, you can, I think that Francisco and Richard, I think they can unmute, right? Or that you can raise your hand or unmute. You can ask the questions to Corina right now.
Yeah, and just before we get into that, I just recalled, I want to show you all again the continuing education attestation form, the tongue twister. Okay. So this is the form that I was mentioning that you guys will all be completing when you submit your application. So it's very straightforward. So you'll just put in your first legal name, last legal name, your date of birth, and then you'll be checking off that you're applying for the CHW. And then you're signing your name saying that you attest to completing the 24 hours of recertification. So you would print your name here, sign off with the date, pay the fees, and that's it. That's all that you're submitting for this recertification process. Okay.
Thank you, Corina.
Yeah, you're welcome.
That was good that they showed it, because it's a really good, easy step that they need to do. But again, do you have any questions for Corina with all the information that she provided right now?
I have a question, but I don't know. I know that they have to prove citizenship, but we were wondering if somebody has DACA, are they ineligible?
That's a really good question, and Corina, that's a question for you. That's for the state. I'm actually, that's the first time that I've heard the question, Edney. So that's a really good question. Maybe Corina, if you don't have it, maybe you can ask about that.
Yeah, so I actually do have that one. So that question has come up before, and I don't know that we got an answer if it was addressed in the FAQ document. So I'm gonna check the FAQ document, and then if not, I'm gonna reach out to the special licensing team.
Remember, sorry, Karina, go ahead.
No, Joe, go ahead.
I just was gonna add in, remember that it's not citizenship, it's citizenship or alien status.
Mhm.
So people that are alien residents, et cetera, also qualify.
Yeah, I was seeing that. It's kind of murky. There's somebody that we were trying to help, and so we were just having a hard time with that, and we were just wondering about it, and also just because the whole process, so it'd be better to just get like a straight answer.
That is true. And Karina, I think that's a question that you can just clarify and make sure. And we'll post it, Edney. We're gonna be posting the recording in our website. We're gonna send it to the CHW Coalition, and we'll make sure that we're putting writing down the questions. And Corina, if we don't have the answer right now, Corina's gonna look at that, and we're gonna put the answer and post that as well, so everybody can actually see and get the information back.
Yes.
Okay. Anyone else has another question for Corina? Okay, so if no questions, then Corina was talking about the continuing education, and many of you, and hopefully you have participated. You know that ASHA is always trying to put together trainings and bringing them as training wheels, which we try to build from with the first training to the next one and next one, and connect all the details of a specific chronic condition or a social determinant, whatever we're offering. And we do a lot of mental health trainings and webinars. So if you have participated on those, we try to always provide you a certificate of participation. And the certificate of participation will have the 1 hour, 2 hours of participation. Make sure that you just have those handy, and you just put them in the file, just put them there, because those are they're able to count those as continuing education. Like Corina said, there's other organizations that are also already approved to provide those continuing education. And I think units, credits, whatever we want to use it. We're not talking about CEUs. We're talking about just continuing education, the trainings that we provide for CHWs. And we are one of the sites approved for that. We are currently offering the emergency preparedness for CHW and CHW organizations. That is a training that can also qualify for this. So if you're not participating, make sure that you sign in and participate on those. You have to really participate, because we do look at the count. We look at who stays the whole 1 hour, 2 hours, and then we provide the actual timing that you are participating, and we provide the certificate for you all as well. And one of the things that Corina was talking about also, a lot of times we don't think that, oh, we still have about a month and a half, 2 months for the recertification. We don't have to wait until it's 1 month before. You can actually start applying when you want to apply, and make sure that you're ready for that. At least 30 days, I think, Corina, 1 month before it's expired. So we are offering, like I saw that Dr. Ana Celia Martinez had put in the chat, that ASHA still has scholarships to support you through the certification of CHWs, but also we're going to utilize those funding to provide scholarships for the recertification as well. So if you're looking into recertification of the CHW workforce and the certification at the state level, we do have that opportunity for you to apply. Francisco is the contact person. Francisco and Richard, I believe, they are the ones that are being in contact with the individuals that have been applying. If you are interested, please make sure, Francisco, you can put in the chat your information, your email, and Richard as well. So they can actually reach out to you and ask you if they need a scholarship for this. The other thing that I wanted to mention is that the attestation form that Corina mentioned at the end is super important, because a lot of times, even through the certification, just through the volunteer certification process, a lot of times we don't think that it's a really important document, but it is. A lot of times you don't get certified just because there's something missing in that attestation form. And we need to make sure we look at the things that we need to fill out and fill it completely. Even if it's just the 3 questions, maybe 5 questions, make sure that every question is answered. Because if not, you're going to be detained. You're going to say, no, you know what? Yours not complete, as you don't qualify, and you're going to have to do another step. So let's try to be really detailed. If you have any questions, if you need support in submitting the volunteer certification or the recertification, you can also reach out to us. Francisco and Richard are always going to be there to support us as well with that. And what else was I going to say? I think, Ana Celia, is there anything else that's coming that the CHW workers can actually take advantage of the trainings that we're going to be providing?
Yes. Hi, good morning, everyone. And actually, we are going to have, as part of the celebration for CHW Awareness Week, we're going to have an advocacy training happening next month. So if you want to receive more information about the current trainings that we have available, please log into our mailing list. That would be the first step. The second thing that is coming up in the following months, we're actually getting ready for our fall symposium, and that's going to be also coming up soon, as long as you mentioned earlier, the emergency preparedness trainings. We're also getting ready to submit or to start promoting a series of trainings as well on social determinants of health, and at the same time with connecting with mental health. So those are some of the things. This recording will be available on our website. And if you need help with the tracking tool, just addressing or just like to get all your CEs, your continuing education opportunities, or the different trainings that you've attended, we're going to have a training log there for you to print. So hopefully that will be useful as well. If you have any questions, please always reach out. We may not have all the answers, but we know who to ask them to. So we're more than happy to support you in any way possible.
Thank you, Ana Celia. And yes, I know, thank you, Lisa, for putting that. I know that NAU also is working with the CHR movement, and they also have funding for the CHRs to go through the certification and probably the recertification as well. We will continue looking for other funding to ensure that we have enough funding to support all of you that want to go through the process of the recertification or the certification. Just reach out to us, please. And Christopher, I haven't seen you for a long time, and I know that you're one of the first ones that got certified, right? And you're actually one of the first ones that need to get recertified. So is there any questions that you have?
No, I just was making sure that I could find all the places that the CEs are offered, because I am coming up here very soon. And so I want to make sure I can keep up my certification.
Well, Christopher, you just sign up to the trainings that we have right now, the training wheel that we have. Hopefully, yes. And you have been part of that. So just make sure that you have those certifications and certificates, I'm sorry. And if you don't have them, please send an email to Francisco and just see we can find you on the list on those, because we keep the recordings. And okay. We can just make sure you can tell us when, and we'll be able to provide you that certificate of participation with the hours that you participated. The continuing education is really simple. I know that many organizations offer trainings around cancer, around chronic conditions, around mental health, and others. Though, just make sure that you just keep a track of all the trainings that you have attended that are for CHWs. They talk about the core competencies. They talk about the role of the CHWs and how we can support. Those are the trainings that we're looking for, because we are talking about recertification and certification of the CHW workforce. So we want to make sure that it is aligned with these certification that we all have. So just make sure that you have those and just keep track of that. And if they don't mention, just make sure that when you connect with your organization or the organization that's offering, you can ask them, and if there's is that a connection with the CHW workforce, or is that another profession or whatever, just so you have an idea of what training you have participated in that are aligned with the CHW workforce. And maybe the state is not even gonna ask about that, but it's good that you have the information just in case that something comes back. Okay.
Thank you.
No, thank you, Christopher. Anything else? Any other questions that you might have or might come up, or any confusions? Do we need to repeat anything in Spanish? Please let us know.
I do have a question, Flor. Good morning, everyone. I'm Arturo Luna with Radshell, and thank you, Corina, for all the wonderful information that you just shared with everyone. I have a question. If you were planning to provide this information completely in Spanish first, and if is there any other upcoming presentation or webinar that will be available in the future weeks?
Yeah, most definitely. Thank you. So the only thing I have right now in English and Spanish is the FAQ document. So that covers the entire initial application process for the CHW volunteer certification application. And then we added those second information about the recertification. So yes, we have that in English and Spanish. We also have a quick one-pager that goes over pretty much everything that's in the PowerPoint. It's just in a condensed version. Astral did help us with that as well too, to convert to Spanish. So we'll provide that as well. And I believe that's all for now. The PowerPoint presentation itself is not in Spanish, but that's something we can definitely do if that helps folks out more.
Perfect. Thank you so much.
Yeah. And then
Thank you, Arturo, for asking that question, and thank you, Corina. I do believe that, Arturo, you do work with a lot of rural community promotoras, and the need for the information in Spanish might be there. So if you do have a sense that it's needed, Corina, will we be able to add another one on the series that we're having on the webinar series in Spanish to ensure that all the CHW promotoras can actually get the information as well?
oh yes.
We can talk about that, and maybe at the end we can do a Spanish one, a repeat, or maybe you don't have to wait until the end.
Yeah.
But we just want to make sure that you guys all know that this is the first of the 4 series webinars that Corina and I are putting together. Well, not Corina and I, ADHS and ASHA are putting together to ensure that you guys have all the information, and that you guys follow, because it's not only just the certification. We're going to be having access, talk about the actual codes and how to utilize those codes, and how to ensure that you have an idea of what qualifies under those codes and all those things. And that's going to be, I don't remember how you're cutting it, but I think it's next week or the following. Next week
on September 11th.
Yeah, and the third week of the seminar, that we're going to put in together, is going to be Allison from the Advisory in Healthcare, that she has a lot of great information of actually the reimbursement possibilities, areas, how to really understand what's going on with the reimbursement codes, payers, and what are we looking at? How do we make sure that we are able to reimburse services for CHWs, and all the information has able to put together. And the last one is going to be with Contextor around the actual community cares model, and how CHW organizations can actually become a community cares organization, and also be one of those connectors to the referrals of the providers, and actually get CHWs to do services and address some of the issues with clients, patients, and get also reimbursed for those. So it's a really nice and neat process that I'm even learning about every single thing. So I really invite you to make sure that you follow, because we're talking about the CHW workforce. We're talking about ourselves, about our profession, our about our us that we're working every single day. So we want to know what's going on and how it's going to impact us, not only the work that we're doing, but also if we're there, we're able to sustain these positions, who is going to be really impacted is our community, because they're going to be able to get those services from your services you're providing. So we need to sustain those positions. We need to make sure that everybody's informed, but also we need to get your voices in every single process that's happening in our state, because since the beginning that we started utilizing and making sure that we talk about models and getting the voices of CHWs, the voices was our voices that came together to get those recommendations for the voluntary certification. Nothing was done without our voices there. So we need to continue like that. And please, every single time that you hear about training, a meeting, whatever, that we're going to be talking about CHW workforce, please join. Please join. And if you can't join, ask questions, send questions, but always get involved. And because we need to make sure that we define our workforce in our state. Okay. So with that, Corina, anything else that you want to add that we forgot that we can provide? Any other information?
At this time, no. I mean, I have everything that I shared with you all. We'll send that out to you guys again. And please, 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 if you have additional questions or you need that extra help and you want one-on-one time, please reach out to me. That's what I'm here for. I'm here to help you guys, to guide you and provide that technical assistance if I can. Again, I'm fairly new to my position, so if I don't have the answer right away, I will get that for you and get you the answers that are needed. So yeah, reach out to me at any time and I'll help you out. Special licensing is here to help you as well too. Again, they take a little bit more time to return emails and phone calls because they're so busy, especially with their new transition. But again, I'm here. You have Floor and Ask Chow. They're absolutely amazing, as you all know already. So they're available as well too as that extra resource. I think that's it for now. So yeah, if you have any questions, please reach out to me. I did put in the chat the upcoming series that Floor was talking about. So we have the second one on September 11th from 9 to 10. That's going to be the utilizing the 3 billing codes from Access. The third one will be September 25th from 9 to 10, the creating CHW pathway to sustainability. And then after that, October 9th from 9 a.m. to 10 a.m., the CBOs as providers with community cares from Contexture. So ASHA will be sending that out and we'll get those links to you all so you have that ready, but at least you have the dates in mind.
Awesome. So I just want to open it one more time before we say goodbye and give you back your time. I was 15 minutes. If anybody has any questions before we end today. All right, well, you guys know where to find us. Please reach out, email. You guys don't have my email, and a lot of you guys have my cell phone, so text is good as well. So any questions that you have, please send it over, because we want to make sure that you guys are ready. You guys have no problem when you get recertified. And Christopher, please let us know if you need any of our certificates that we have not provided you, with the trainings that you participated in, and we'll get that to you. Make sure that you are ready for the certification.
Okay, thank you.
All right. With that, I just say, is that, and Corina, do you think anything else that you want to say before we?
Just thank you all so much for being here and for welcoming me into the CHW realm. I'm a transplant from California, and having worked with you all, met you all, it has been very, very rewarding, and it kind of just solidifies how I got into public health and why I love doing what I do, and getting to work with you all and seeing the passion and commitment you have to your community. It's very empowering for me. I see that, I acknowledge it. And so I want to take this time to tell you all, thank you very much for what you do, the work that you do, and for entrusting me to jump into this space and provide you that guidance and technical assistance. So please reach out. I do want to help as much as I can. That helps me and helps me to learn and continue to grow and make an impact on our communities. So thank you all.
Thank you. And one more thing is that I want to ask Jill, Jill, are you still here?
Sure, right here.
I just, do we have the next day for the CHW coalition so we can put it there? Because if you are not participating in the CHW coalition in Arizona, you should be participating, and we meet every 3 months. And you guys should come because we talk about everything CHWs in our state. And we always try to gather and provide you the great information, but also gather those great voices and give us information on how we should proceed in our state. Do you remember, Jill, when that next
Yes, it's,
time?
yeah, the date is October 25th. Save the date should be going out very soon, but it's October 25th from 10 to 12. So everybody who's on this webinar, put it in your calendars now. October 25th.
And who should they contact? Should they contact one of us or you if they wanted to be added into the listserv?
Sure, they can contact me, you, or Anacelia, any of us, Karina, and we can get you added to the listserv. Absolutely. And it's October 25th. Yeah. Thank you, Anacelia.
So I just
Yeah.
threw it in the chat as well too. So on the chat, there's the email that you can subscribe to get all the information for the CHW coalition list. So this includes upcoming meeting dates, any type of resources, news flashes that we want to send out to you all. You can sign up through there to get those blasts. And then there's the list.
Yeah. Thank you, Karina, because you can actually just go to that and add yourself to the listserv.
Mhm.
Yes, and now we have translation for the promotoras that want to join the meetings. We just started having translation, so now every meeting will have somebody that's gonna be translating, so simultaneous translation. So if you are not comfortable in English, you can still join, provide your great voice, and really join the conversation and in Spanish in your language, and we'll have that translation there to everybody, so everybody can connect and be on the same page.
And we're very appreciative to Partners in Health for supporting that translation.
Definitely. Well, if there's no other questions, and just want to say thank you so much to Corina Ojeda for bringing that great information. Thank you so much to all of you that made the time to come together today and listen and ask the questions. And if you don't have the questions right now, please send them on to us and we'll make sure that Corina gets them as well. And we'll make sure that we are all aligned and ready to get recertified when the time comes. With that, I just want to say thank you so much to all the team of ASHA that allow us to make this happen and put it together really fast. And we'll see you next week. Hopefully you can join us in the next session of the webinar that we are putting together. Have a good one.
Bye,
We'll see you
everyone.
soon.
Thank you.
Bye.